I'm Dr. Cully White, neurosurgeon in the Milwaukee area. I specialize in spine surgery and did a fellowship in minimally invasive as well as complex spine surgery. Patients with cervical spine pathology usually present to their doctor with complaints of neck pain or arm pain. The neck and arm pain comes from the disc deteriorating. When the disc deteriorates, it loses its height, it sinks down, and that causes compression on the nerves or the spinal cord. Whenever a nerve gets pinched, that can produce the pain in the patient's neck, or sometimes that pain will radiate down their arm. Sometimes patients don't have pain and they just present with numbness in their hand or arm, or weakness in the hand or arm, depending on which nerve is innervated. What we'll do is get an imaging study of the cervical spine, which would involve either an MRI or a CAT scan, and that'll give us a detailed picture of what's going on in the patient's spine. We'll be able to see the nerves, the spinal cord, and the bone and the discs with these imaging studies. From there, we'll put that together with the patient's symptoms and see if we can define the source of their pain. Often we'll see a herniated disc, which is the softer material between the two bones, will be protruding posteriorly, pinching the nerve. Or we'll see a bony spur that's causing compression of the nerve. In either case, that's usually treated, if the patient fails conservative therapy with physical therapy, medications, or steroid shots, we'll often proceed with a surgical procedure in which we remove that bony spur or that herniated disc to relieve the compression on the nerves. By relieving the compression on the nerves, we'll relieve the patient's pain, their muscle strength will improve, and their sensation should improve.
Hello, I'm Bethany Kramer. I'm Dr. White's physician assistant. And from the moment a patient steps through the door, my job is to help Dr. White guide them through the surgical treatment options for their pain, to help prepare them for surgery, and then to help them know what to expect after the surgery has been performed. With this particular patient, the case was very straightforward. The surgery was uncomplicated and was completed in about 45 minutes. The patient went to the recovery room and ultimately went home in about 4 hours. Post-op day number 4, I actually called to see how he was doing. He said he was doing great and actually asked if he could go back to work.
Minimally invasive spine surgery and motion preservation spine surgery is definitely the way of the future. As these techniques evolve and become more popular, this will take the place of the original and traditional spinal fusion surgeries. This new technology makes the most sense as it allows patients to maintain their regular range of motion and prevent further disease at other levels in their spine.
Dr. White is one of the few neurosurgeons who routinely does minimally invasive spinal surgery, including the artificial disc. So if you're in the area, we'd be more than happy to consult with you regarding your condition. Thank you for joining us.